Thank you, Dr. Mehta, and I will move into my presentation that was really interesting and I think highlights some of the issues that I want to raise, that reproductive rights are fundamental human rights, and they must be protected to ensure the dignity, health, and well-being of every person. And we can see from what we just heard from Dr. Mehta how there's such interplay between traditional healthcare and then, of course, all of the social factors that are around women and pregnant people. So what we've seen when we look back through the history of the support that women have gotten traditionally through our healthcare system and other services, we've seen that every advance toward equity through state and federal laws and regulations is often met with challenges. And I'm going to go through a couple of those today, Title X, the Affordable Care Act, where we are with Medicaid and the Hyde Amendment, and access to abortion. And then just quickly at the end, mention some steps forward that I think create some opportunity. So let's start with Title X. This has gotten a lot of press in the last really year and a half. And let me give you a little bit of background. I think this was a program that not a whole lot of people were that familiar with until it became challenged. So the Title X Family Planning Program was created by Congress in 1970 with bipartisan support. It is a federal grant program that lives within the Department of Health and Human Services. And the goal of this program was to provide, or is to provide, reproductive health care, including contraception, STI testing and treatment, breast and cervical cancer screenings. And it was originally directed at young or uninsured or otherwise disadvantaged patients. So that was 1970 when Title X started. Then in 1973, the Supreme Court decided in Roe v. Wade that access to abortion was a constitutional right here in the United States. And so many of the programs that also received Title X funding began to counsel women who were seeking abortion services. Everything was going along fine until 1988, when the Reagan administration enacted what was called at the time the domestic Gag Rule. And that rule restricted providers who received Title X funds from providing abortion counseling or referrals. So this domestic Gag Rule was challenged in court, worked its way up, and was upheld by the Supreme Court in 1991. And then in 1993, when the Clinton administration took over, they reversed the policy. And their rule said that all pregnant people should be provided with, quote, neutral, factual information and non-directive counseling. So again, things were quiet and stable until 2019, when the Trump administration issued a new set of rules and required the Title X providers to refer pregnant people directly to prenatal care, regardless of their wishes for the pregnancy. Additionally, they prohibited informing patients about all options, and they blocked Title X funds to any provider that also offered abortion care. Now, prior to the Trump administration's rules, Title X granted about $387 million annually to independent health clinics, Planned Parenthood, state, county, and city health clinics. And they served approximately 3.9 million people, including 600,000 teens. Importantly, these funds disproportionately serve Black and Hispanic, Latino, and Latinx patients and rural communities. Following the Trump administration's Gag Rule, the number of clients served by the Title X program fell by nearly 4 million people in 2018, down to 1.5 million in 2020. Now, to be accurate, obviously COVID-19 hit during that time, and HHS estimates that about 37% of that drop was due to COVID-19 and people not coming in to receive services. But even backing that out, you can see that there was a substantial decrease in access to services due to the rules from the Trump administration. Last Monday, a week ago Monday, on October the 4th, the Biden administration did announce reversal of this Gag Rule. And in early November, funding will be restored to all of those providers that I mentioned earlier, and there will be no restraints on their speech. I believe they will revert back to what was in place prior to the Trump administration coming into office. But that's just one example of how a program that was passed way back in 1970 with bipartisan support has been sort of treated very differently depending upon the administration in office in Washington. So now I'm going to move to the Affordable Care Act. The Affordable Care Act was signed into law March 23rd, 2010. And there were numerous provisions very explicitly written into the Affordable Care Act to support women and pregnant people, including improved access to insurance and lower costs for that insurance for many people. It expanded Medicaid, and at this point, 38 states and the District of Columbia have taken advantage of the opportunity to expand Medicaid, although I do have to point out that there are still 12 states that have not. Under the Affordable Care Act, key preventive services are provided at no cost, including things like mammograms and other preventive health screenings. And very importantly for women, women can no longer be charged more simply for being a woman. This was common practice, including after a woman was past her childbearing years. Women on average paid more for their health insurance premiums than men did. Women were also denied coverage because of pre-existing conditions like breast cancer, pregnancy, having had a C-section, or been a victim of domestic violence. Another very important provision of the Affordable Care Act was that contraception was included as a preventive service to be covered by insurers and employer-sponsored plans without cost sharing. But this provision was controversial from the start. In the original law, accommodations were put in place for houses of worship and other religious organizations. And when I say accommodations, I mean that those organizations still had to use a mechanism that would allow their employees to have access to no cost sharing contraception, but they didn't have to offer it directly. This provision was sued. There were many people who sued over this provision. It worked its way up to the Supreme Court. And in 2013, the Supreme Court added accommodations for secular employers that objected to contraception on religious grounds. So you could own any type of business. It didn't have to be a religious organization. But if you objected to contraception on religious grounds, then you no longer had to offer contraception directly, but you still had to offer those accommodations. In the Trump administration, they exempted employers objecting on moral grounds. So now you could object on moral or religious grounds. And the Trump administration also added exemptions to the mandate, meaning that you didn't have to offer contraception at all in any way, shape, or form. So before you had to at least offer an accommodation to your employees, now you did not have to do that either. And in Little Sisters of the Poor versus Pennsylvania, the Supreme Court upheld the Trump rules in July of 2020. It's been estimated that between 70,500 and 126,400 individuals lost access to contraceptives without cost sharing because of this Supreme Court decision. So when we move on to abortion services, which has obviously gotten a lot of press in the last couple of weeks and months, I'm going to start at some of the decisions that have been made at the Supreme Court level. So I mentioned earlier, Roe v. Wade was decided by the Supreme Court on January 22nd, 1973, and that made abortion legal and a constitutional right here in the United States. In Planned Parenthood versus Casey, that was decided on June 29th, 1992, the Supreme Court upheld the constitutional right to abortion in the United States. It added a viability standard. Previously, the rule had talked about trimesters. So it talked this under Planned Parenthood versus Casey, it switched to viability. And they put in place something called an undue burden standard, meaning that states could regulate abortion, but not if it put an undue burden on a woman's ability to obtain an abortion. So in Planned Parenthood versus Casey, there were several things that the plaintiffs were asking for. And the court allowed a waiting period and they allowed parental consent for a minor, but they disallowed spousal consent. They declared that spousal consent created an undue burden. Then we saw in Dobbs versus Jackson Women's Health Organization, that is the latest case. This is a case from Mississippi that the Supreme Court is going to hear on December 1st. It will determine the constitutionality of Mississippi's 15-week abortion ban. It's estimated that about 6.3 to 7.5% of all abortions that occur in the United States occur after that 15-week period. The other thing that's very important about Dobbs versus Jackson is that they have asked the Supreme Court to actually overturn Roe v. Wade as part of this lawsuit. And what is important to understand about that is that there are 22 states that currently have laws on the books that would restrict or ban abortion if Roe is overturned or restricted. Those are commonly called trigger laws, meaning that if the Supreme Court makes a decision, say, to overturn Roe, then the law that already exists on the state at the state level would be triggered and could either ban abortion or severely restrict abortion in that state. Now, when we get to the state level, since Roe v. Wade was decided in 1973, we've seen a total of 1,313 abortion restrictions enacted at the state level, but it's really been accelerating in recent years. 566 of those have been enacted since 2011. These restrictions increase patients' logistical, financial, or legal barriers to care, and they disproportionately impact people with low incomes, people of color, young people, and LGBTQ+ people. Between January and June of this year, of 2021, there have been 561 abortion restrictions, including 165 abortion bans introduced in 47 states. They haven't all passed, but as of June, 83 restrictions had actually been enacted, including 10 bans in 16 states. And this just gives you a quick visual as of the end of 2020, what the picture looks like in terms of states that are very supportive, ranging to very hostile when it comes to abortion. And this slide just shows you some of the impact of these laws that have been aimed at restricting abortions. The blue bars show the change in the number of abortion clinics, and the sort of darker kind of teal bar is the number of enacted abortion restrictions. So you can see, particularly in the South, high levels of restrictions correlating with large numbers of clinics having to close. So the things that have gotten the most press in this past year are the Texas law that went into effect on October the 1st. It is a ban on abortions after 6 weeks, a time when many women don't even understand that they're pregnant. It's created a bit of a vigilante system in that anyone can sue an abortion provider or anyone who helps a patient obtain an abortion, including someone who provides transportation to get that abortion. And this person can live anywhere in the country. They don't even have to live in Texas. It also offers a $10,000 reward or bounty for a successful lawsuit provided under this law. And of course, this is also currently being fought in the courts. And so far, though, it is still in effect. It was briefly stayed, but it was reinstated about 48 hours later. Here in Pennsylvania, we've seen some very restrictive laws introduced in our General Assembly. There was something called a heartbeat bill that would prohibit abortion after a fetal heartbeat is detected, but it really refers to fetal electrical activity, not even an actual heart beating. There is a Down Syndrome Protection Act that would preclude abortions for the reason of a child having Down syndrome. And then the Unborn Child Dignity Act, which would require the offering of burial of fetal remains, even of a miscarriage, and the creation of fetal death certificates, and a lot of really substantial burden on anyone who has suffered a miscarriage or abortion. So these laws are not in effect in Pennsylvania. They have been passed through our state house, and they are awaiting votes in the state Senate. Also, just want to mention that access to abortion services has been very hampered by insurance coverage. The Hyde Amendment was passed in 1976. It prohibits federal funds for abortion services to anyone who gets their insurance through Medicaid, Medicare, or the CHIP program. It affects people in 34 states and the District of Columbia. It's estimated to impact 7.8 million women aged 15 to 49. There are 16 states, though, that provide their own funding for people who are in their Medicaid programs. Again, this law disproportionately impacts people of color. It also impacts all federal employees, military personnel and veterans, Native Americans, and Peace Corps volunteers because of how they get their health insurance. And this is just a visual depiction, again, of where the Hyde Amendment withholds abortion coverage from people enrolled in Medicaid. These orange states are the ones where there is no coverage. Under the Affordable Care Act, the Hyde Amendment applies, so it does prohibit federal funds from being used to pay for abortion services. Insurance plans sold on the Affordable Care Act exchanges may or may not cover abortion services depending upon the state. 18 states currently offer coverage. Pennsylvania is one that does not. Plans that do offer coverage must keep the enrollee's payment for those services in a separate account so that they don't mix with federal funds. The Trump administration added a new rule in 2019 that any plans that do cover abortion must issue separate bills for that coverage so that an individual would actually get two bills. But a judge has overturned this rule in July of 2020, blocking its implementation. And the Biden administration has finalized a rule that will permanently prevent that two-bill rule from going into place. So individuals will just receive one bill. So that is just a very quick overview of how these policies interact with politics and the impact on reproductive health. In terms of next steps, right now, the federal House of Representatives in Congress has passed the Women's Health Protection Act. This would establish a statutory right for healthcare professionals to provide abortion care, and it establishes the right for patients to receive abortion care. It will be free from medically unnecessary restrictions that single out abortion care. And again, the House of Representatives passed this on September the 24th, and it is awaiting a vote in the United States Senate. And I also want to draw your attention to something called the Blueprint for Sexual and Reproductive Health, Rights, and Justice. This was released about a year and a half ago, and I think it just has not gotten enough attention. It's a really comprehensive document centered on 5 principles around equity and access to services. It's been endorsed by more than 90 organizations. And I refer you to 2 groups, the Guttmacher Institute and the Center for Reproductive Rights, which are nonprofit organizations that are really credible sources on issues around reproductive rights and access to abortion. Thank you.